Are you getting that numbness, pain, and tingling into your hand? Maybe it's into the palm, maybe it's these 3 fingers, maybe it's these outer fingers, maybe it's the inside, the outside of the hand into your arm. If you're getting carpal tunnel type of pain, then today I'm gonna go through some of the most undiagnosed reasons for getting the issue, and more importantly, exactly what you could do at home in order to get better. I'm Dr. Matthew Posa. Welcome to my page. My page is dedicated to people and families with health tips and tricks so you can live the life you were designed to live. So don't forget to like, subscribe, and share this information with the people we know need it the most. There is an area of the spine that a lot of people completely disregard, because when people are getting numbness, pain, and tingling into the hand, there is the regular testing. Well, they'll test the nerve that goes into your arm. They're gonna test to see if there's a nerve conduction study, and therefore we know that the nerve is irritated. Maybe the nerve is being compressed. And even when they're doing carpal tunnel type of surgeries, well, they're gonna cut the wrist, they're gonna decompress the area, because there is the median nerve, so there's a nerve that comes into the inside of the hand. Now that one is the most common one associated with carpal tunnel. But then you have the outside nerve, and so there's a nerve that goes on the outside that supplies these fingers. So if you're getting that, then you have ulnar nerve type of pain. There you can get it at the back of the hand. So there's a lot of different ways that you would describe it. It's important to know how you're feeling it. But today we're gonna stick to the carpal tunnel. And when it comes to carpal tunnel, most people's treatment is gonna be in here. But it's important to note that median nerve exits not in here. It doesn't even start into the elbow. It doesn't even start into the shoulder. It actually comes out of the neck. And in fact, it comes out of the lower part of the neck. So one of the things, and being a chiropractor, one of the things that we always check first is we look at your circuit panel, which is your spine. And the circuits, your spine joints at the back here, well, if there's compression, if there's misalignments there, well, these are the nerves that travel into the front of the neck, and we're gonna talk about that in a second, and they travel down into the shoulder and then down your arm. So most of the time, people are gonna be focusing in this area. And in fact, if you look at a lot of the stretches online, you watch a lot of the other videos, they're gonna be talking about how to stretch your arm, how to create less tension, how to floss the nerve. And there's a lot of videos out there on that, and there is a lot of good help with that. But we're always usually missing where it actually starts. And so if we look at your anatomy, we look at where the nerves come out of. So there's a lot of muscles in the front of your neck here. But what happens is the nerves that come out of the lower part of your neck, they go around some of these muscles. They go on top of something called the first rib. So you have your ribs, right, that everybody feels in here. But the first rib starts at this point right here, goes underneath the clavicle, and wraps back to the back of your spine. And so that area is where the nerve can get compressed. So one of the areas that I often see people who have that carpal tunnel, numbness, pain, and tingling into the arm, the top area that we notice is that first rib subluxation. That first rib is off. The clavicle can be off. And then what happens is all the muscles in the neck, whether it's the SCM, which runs this way in the front, whether it's the scalenes, whether it's even the pec minor, which is in the front of your chest. These areas are the ones that most people are not touching. So that's what we're gonna talk about today and what you can do about it. And so if you got that numbness, pain, and tingling into the right arm, what I want you to start by doing is see whether or not it's coming from your neck. So here's your test. If you got numbness, pain, and tingling, you're just standing there, what I want you to do is bend your neck to the same side. Now, if you bend your neck to the same side and you notice there's a relief, it actually feels better, well then there's a high chance that it's coming from here. And in fact, you might have another condition called thoracic outlet syndrome. So another test there then would be, and if you're not already getting confused, follow me along here. The other test is gonna be if you bring your head, or keep your head neutral, bring the affected arm up and above. And if you do this and it feels better, you're getting a relief from this, less numbness, pain, and tingling into the arm, then you know it has to do with this upper area. It has to do with it. So the source of the issue is here. It's not here. It's just you're feeling it down the line. You've pinched the hose, as another way of thinking of it, and that hose, the water is traveling down here. So you're pinched in here. So this is the area that you need to get checked. Definitely go to the chiropractor. Make sure that they're adjusting the area, setting back the rib, checking this. But then we're talking about these muscles. So there's the scalene muscles, which are deep in through the bottom of the neck. There's that SCM that I talked about, and there's the pec minor. So let's talk about how to do those. The first one is the SCM, and the SCM stretch is super easy. All you're gonna do is turn your head to the opposite side. So again, if this is the right side, this is the side that hurts, well, I'm gonna turn my head to the left. I'm gonna arch my head back to the point, so you're gonna see my head is back, and now you're gonna notice that muscle is sticking out. That's the muscle that we're working. And you wanna hold that for 15 to 30 seconds, 30 seconds being the ideal. If you're starting to get dizzy or anything like that, then definitely stop. That would be probably one of the things I would be looking out for. You can use a wall to support you in case you feel like you're gonna fall, especially depending on your age or other conditions. But holding your head this way, if you want a little bit more pressure, then depress. You're gonna push down on your right shoulder as your head's turning to the left, and now you're gonna get a deeper pull into the front. So that is a really good stretch for the SCM. But now if we were gonna target a little bit more into the scalenes, I would still push down on the shoulder, but now what I'm gonna get you to do is, instead of having this crazy rotation and arch this way, we're gonna get a little bit more of a side bend away, and we're gonna hold that to the side. So it is you could still turn your head maybe more on a 45. Some people, you'll want to go more even, but then you're gonna get more of the back of the trap. So really, you want a little bit of a 45, not that crazy extension like we did with the SCM, to the side. Hold this for 45 seconds. Depressing this would be even better if you can. And then you're gonna get that. Now, if you notice a massive amount of relief, then I'd be really curious to see what your x-rays look like on your neck, what that feels like, and any of our neurological and orthopedic testing to see what the problem looks like. Is there degeneration? Is there breakdown? Is there arthritis? Is there nerve compression? We would want to figure that out, and that would be part of your testing. The last part of this is going to be your pec minor. Now the pec minor actually goes on an angle, so it actually goes this way. So a really good way to stretch it is to do like the stop sign. So you're going to bring your arm up this way, and then you go into the doorway, and then you push forward. So you're gonna put your hand against the doorway, bring your body forward, but your arm has to be up in order to get this. If your arm is too far down, well, then you're getting more of the pec and not necessarily pec minor. So it's this guy at the top that's gonna help with that. If you're experiencing any of those symptoms and you're noticing that that's what's actually causing that, and by doing that stuff, you're getting relief, then make sure that you go to a chiropractor in your area. Make sure you get the proper assessment, whether it's x-ray and scans, but make sure they're doing the proper assessment in order to determine what's going on in your neck, why is this happening in the first place. Combined with some of the stretching, getting your spine adjusted and corrected, then you should see the long-term results, and now you've avoided any type of surgeries, any other types of drugs, and you're on the path to wellness. There's a lot of different reasons why people get carpal tunnel, numbness, pain, and tingling into the arm. There could be nerve compression. There can be issues with irritation, swelling. There could be even diabetes. There could be so many types of reasons why people get this type of radiculopathy where the nerve is being irritated. And so it is important that you take the proper steps. If you have a family physician, make sure you go see them. Make sure you get the proper testing done. If you have a family chiropractor, make sure that you're voicing these concerns, because a lot of the times, if we understand what your background is, we understand what you might be going through, we could take the proper steps in making sure you're getting the proper referral and or the proper treatment. If you have any questions about this video or anything else, please leave a comment down below. I always do my best to answer them. And until next time, have a great day.